I'm Dr. Akmal. I'm a family medicine doctor with the Hamilton Physician Group. I am currently living in Chattanooga, Tennessee. I just moved from Charlotte, North Carolina after completing residency, and I am now living with my spouse, who's also a doctor. So with Hamilton, when I was looking into the area, the interview felt like really warm and felt really natural. It almost felt kind of like home, and I was lucky enough that it was close to home because it is close to my parents in LJ. So it really just worked out. Well, I am a family medicine doctor, which means basically I take care of all ages. So starting from newborn, pregnant women, adolescents, older people, literally I have the ability to take care of everyone. And that to me really, was awesome. Being able to be trained to take care of every condition, illness, and think about those things really was the heart of medicine for me. And that's why I chose family medicine. Yes, I told everyone when I was 5 years old I'm going to be a doctor, and every Halloween I dressed up as a doctor in scrubs. So I was very adamant about this from a very young age. So I think who we are does come a lot from influences of our family and like our mentors and people that we admire. But I think it's easy to say something, but like going through the motions and really realizing I really do love science, I really do love talking to people. I think it was set in stone more in my college years that was the right thing to do with shadowing doctors, and it is something I'm very passionate about. So it started as an interest and a potential thing, but I think it really made sense and really was what I was passionate about in college. Because if I did not like it, that would be a different story. Yeah, so I went to University of North Georgia, graduated with a bachelor's in biology, loved it there, and then I went to Nashville, Tennessee and studied at Meharry Medical College for 4 years, and then I went to Charlotte, North Carolina, where I trained at Carolina's Medical Center for 3 years, and I just recently graduated. I don't think there's one specific person. I think the journey, or basically where I am right now, is like a culmination of everyone who I've had. I feel like everyone has something to teach you. So whether that was my preceptors, whether that was my dad, whether that was my co-residents, it's everyone. It's, everyone has some contribution to, my education and everything that I've learned up till today, I would say. I think, a great physician is someone who is deeply compassionate and cares. Because if they care, then that means that they will, make sure that you're well taken care of, think about all the things. And someone who's a good listener. You want to feel heard and understood, at least I would as a patient. I think I operate with the golden rule, right? Treat other people how you would want to be treated. And of course, we all want to be treated well. So I kind of think about that. And I think my philosophy in life is like trying to be there for people that I love or admire, or my patients, as in any way possible, whatever that means. Whether that's listening, whether that's being present, whether that's checking in every once in a while. So I think that's kind of how I live my life, is, making sure people know that they're important and being there, especially in time of need. My favorite part is being able to make a difference in people's lives and seeing them, at the worst of times and at the best of times, and really trying to see like how I can help in their life. So that would probably be my favorite part. What it comes down to is I think about how I would want my loving family member treated, and that's how I approach patient care. Just, being compassionate, being a listener, thinking about how, someone that's really important in my life, how I would want them treated. And that's kind of how I approach it. This is something that I strive for every day, and I hope that, I'm able to do those things.